Hello, I'm Christine Mundo. It's good to have your company. A report out today by Human Rights Watch says hundreds of thousands of people suffering from mental illness are being kept shackled in chains. Many of these cases have been reported in countries across Africa. Researchers found evidence of this happening in Burkina Faso, in Ghana, in Kenya, Liberia, Mozambique, South Sudan, Sierra Leone, Somaliland and Nigeria. According to this 9-year-long study, social stigma attached to mental health often plays a big part, but also a lack of support or awareness about mental illness. Now, here are a few testimonies from some victims that Human Rights Watch have spoken to.
And
for more on this, we've invited Mausi Segun onto the program. Mausi is Africa Director for Human Rights Watch. Welcome to DW News Africa, Mausi. Mausi, tell us more about the victims of chaining. Who do they tend to be?
I mean, it's all demographics. We have seen men, women as old as 86 years old, and as well as children, some as young as 10 years old. They've been chained, locked up in confined spaces for weeks, months, and even years.
And why are people doing this? Tell us more about the perpetrators and why they're doing this.
So, I mean, we have found, people chained for years in state-run institutions, in private institutions, as well as in traditional or religious healing centers, Christian, Islamic. Across Africa, several of the countries we've visited, including Nigeria, my own country, and in Kenya, they're often deprived of sleep, denied food for up to a week, forced to fast in the name of, spiritual healing. They are forced to take medications, herbal concoctions. They face physical and sexual violence and, often caned and whipped. I'll give you an example of one center in northern Nigeria where we found up to a dozen people in one room. They showed our researchers scars on their arms, their chests, their backs, that they said were from floggings by the staff. So this is we should call shackling what it is. It is torture.
Right.
And UN agrees. Yeah.
And Mausi, this is obviously a widespread problem, but I wondered what informed Human Rights Watch to commission this report.
So, I mean, globally, we know from, the World Health Organization and the World Bank estimation that over 792 million people, or 1 in 10, including children, have a mental health condition. Yet, governments spend less than 2% of their health budgets on mental health. That's just mental health generally. When it then comes to shackling people for mental health conditions, that is almost completely under the radar. There's no data, no coordinated response or efforts to eradicate it. And we got on it, just from one example and realized, even while we were working on other issues, that there were so many people shackled, chained to trees, locked up in their own homes, in a cage, in a shed, in overcrowded and unsanitary institutions. I mean, we couldn't look away from it. It was impossible to turn away from this issue.
Let's end off with what needs to be done.
So, I mean, clearly what needs to be done, shackling should be banned. And the ban should include enforcement mechanisms that would ensure regular monitoring of both state-run and private institutions and facilities and all of these healing centers, religious centers. Government needs to invest in quality, accessible and affordable community mental health services. I mean, that's just not an option. It needs to be coordinated. It needs to be a holistic approach to dealing with this widespread problem. And then, a lot just needs to be done to reduce stigma that is associated with mental health.
Right, that's Mausi Segun, Human Rights Watch Africa Director. Thank you, Mausi.